Really?
I'll finish before it. My class is ending by 7.
It's to 10.
I've also checked it. Yeah, it's 10.
And tomorrow, 6 to 8.
I don't have class tomorrow. All right, good evening, everyone. You are welcome to NSC 303 online facilitation. Today, I'm excited to meet you again this week. I hope you all had a lovely week so far. And I want to thank those of us that are already logged in. Thank you for all your efforts. And today is week 7 of our online facilitation for this course, concepts and strategies of community health, community and primary health care. And next week will be our final week, which is week 8. And let me quickly remind those of us that we've not submitted our assignment. That is important that we do our assignment so that we don't lose the mark. It's going to be graded, marked and graded, and your grade will be there. So if you do not submit, you don't expect to have a score for assignment. That means you've lost that mark. So I also want to say that because we did not, students did not come online the first week of this semester, I would like to have an extra class with you on Sunday by 5 to 6. 5 to 6, yes, no 4 to, let's make it 4 to 5. 4 to 5, I will send Seta, thank you for the WhatsApp group that you have agreed to be the class representative and manage that, and thank you for having me. For those of us that are not aware, we have a WhatsApp group for this course, and the link for Sunday extra class meeting will be posted the latest Sunday morning. I will definitely post it. Please bear in mind and feel free to join. So that's a brief announcement that I have for you today. We'll be doing primary healthcare concepts and principles as structured this evening. It's actually Unit 2 topic, and because majority of the students were not around when we actually discuss it, that's why I'm bringing it back for us to discuss this evening. And so what is primary healthcare concept? For how long has it been involved? And what are the principles or the elements of primary health care? Those are the things we want to look at. If you have questions or you want to contribute, please feel free to raise your electronic end or drop your question on the chat and you will be acknowledged. So before we dive into the topic or the discussion for today, is there any of you who has question or wants to clarify anything? Okay. All right. In the absence of question or contribution on what we have covered in the previous lesson, I will move to today's topic. So as I introduced that, what we'll be looking at is primary health care concept and principle structure. And there is a learning goal for this. There is a learning goal for this topic. And the learning goals are as follows. On completion of this unit, learners should be able to discuss and explain the concept of primary health care, be able to define what primary health care is, and also list the elements of primary health care, as well as being able to explain the principles of primary health care and explain the role of nurses in promoting primary health care. Concept of primary health care. We understand that the concept of primary health care has 4 components. And what are these 4 components? We have conceptualization of basic health services, accessibility and availability of health services in rural population, and from the basic concept, from the conceptualization of basic health services to re-examination and evaluation of health services, correlating health with economic development. And after re-examination and evaluation, we looked at the shift of emphasis on preventive approach from curative approach, urban to rural, privileged to underprivileged, and unipurpose to multipurpose workers. And lastly, the final decision was made at the International Conference on Primary Health Care at Alma-Ata in 1798. So we see that the clear indicates of PHC, that is primary health care concept, as its roots in the initial stage of our nation health approach, which is the conceptualized basic health services, accessibility and availability. That takes us to the real definition of primary health care. During the Alma-Ata Declaration in 1978, it is defined as essential health care that is based on practical, scientifically sound and socially acceptable method, and technology made universally accessible to individuals and families in the community through their full participation and at a cost that the community and the country can afford to maintain at every stage, every state of their development, in the spirit of self-reliance and self-determination. And so, should in case you meet this in an exam, just understand that this is a standard definition, and primary health care is essential health care. That is very important. And you have to mention that it is based on practical. It is practical. What do we mean by practical? It means that the healthcare service must be available to the community, to the people. It must be accessible to the people. It must be acceptable by the people, and it must be affordable by the people. So this is what we mean by practical. So this key 4 A's is essential when you're looking at the practicality of primary health care, and it is scientifically sound and socially acceptable method in terms of the technology that is used. It is also a universal, accessible to the individuals and to the family, as well as to the community at large. So this is very, very important that you take note when you are asked to define primary health care definition. Hence, we say primary health care is a practical approach to make essential health care universally accessible to individuals and family. I've just explained that to you. What are the elements of primary health care? Basically, we have elements of primary health care. There are about 8 in numbers. The level of primary health care involve 8 essential elements or components. Education concerning prevailing health problems and the methods of preventing and controlling them. Promotion of food supply and proper nutrition. An adequate supply of safe water and basic sanitation. Maternal and child health care, including family planning. Immunization against major infectious diseases. Prevention and control of local endemic disease. Appropriate treatment of common diseases and injuries. And lastly, provision of essential drugs. And so if you are asked to mention or enumerate or state 4 components or 8 components or 8 essential elements of PHC, remember that they are as follows that I've just mentioned to you. Provision of essential drugs, appropriate treatment of common diseases and injuries, prevention and control of locally endemic disease, immunization, maternal and child health, adequate supply of safe water, promotion of food supply, as well as education. So we move to the principles of PHC. There are 5 basic principles which proved framework of the PHC approach. We have equitable distribution of resources, manpower development, community involvement or participation, appropriate technology, intersectoral coordination. All these are in figure 2, of which we are going to explain one by one. What do we mean by equitable distribution? It simply means that health service must be shared equally by all people irrespective of their ability to pay, and all the people, whether rich or poor, whether based in urban or rural, must have access to health services. And this is the core aim of PHC when it was conceptualized, for accessibility to every individual, so that no person, no human being is deprived of access to health service. And the inability to receive healthcare service by majority of rural people and those living sometimes in urban slum is inaccessibility. And so the aim of PHC is to bridge this gap by shifting this concentrated healthcare system from city or urban areas to the rural setting. And so when you are doing this, we equally need manpower development. And when we say manpower development, whether health care services are provided in urban or rural area, there is need for nurses, doctors, lab technicians, the pharmacists, the health professionals as a resource person. And so primary health care focus on education and training of health workers to perform functions relevant to countries' health problems, reorientation of health personnel, planning health manpower according to the needs of health system in terms of the right kind of manpower, the right number, at the same time, the right place. So we've seen the principles of PHC. The next is community involvement participation. The individual in the community knows their own situation better and are motivated to solve their own problems. And for this reason, the health care provider needs to collaborate and allow a patient-centered care to guide in the caring of the clients at the PHC settings. We also have appropriate technology. It is not expected that sophisticated technology be taken to the rural community at the PHC because most of the time it would not be maximally utilized. And so for this reason, for economical or social or professional acceptability, the technology should be what the people are close to and useful to the consumer. For that reason, it is important that the technology that will be recommended to be implemented at the primary health care are first and foremost scientifically sound, and that the people can understand and accept. Intersectoral coordination. The development of PHC will rest on proper coordination at all levels between the health and all sectors concerned. For that reason, primary health care involves health sectors, all related services and aspects of national and community development. In particular, the agriculture, food, industry, education, housing, public works, communication, and other sectors. So we see that all these sectors are working harmoniously in the sense that if there is problem with food in the community or housing problem, there will be health problems. And so the communication department sector also is a very vital aspect that cannot be neglected. So all these sectors needs to collaboratively work for the effectiveness and progress of the community development when we talk of primary health care. Now we need to understand the role of nurses in all of this. Nurses has a vital role in primary health care. And we have 4 main roles that the World Health Organization in December has identified. We have 4 roles that has been identified by the World Health Organization as nurses' major role in primary health care. The screen shows the nurses as a direct care provider. That is one role. In fact, I tell people that nurses are the main custodian of healthcare services in the primary health care. The nurses as a teacher and educator in the primary health care, in the PAC, the importance of giving health education, it's an essential one. And so nurses do the teaching and educating patients in the primary health care. Nurses as a supervisor and manager. And lastly, the nurse as a researcher and evaluator. We can see how important nursing profession are. So we are going to unpack each of these roles of nurses. When we say the nurse as a direct care provider, what do we mean? You and I as a nurse needs to develop a variety of skills which you have to utilize in both clinical and community settings in order to participate actively in providing care in relation to the components of primary health care. For example, in providing MCH care, that is maternal and child health care, you as a nurse do not only have to examine the mothers to identify risk factors and give tetanus injection, but also teach the group of this mother or this individual mother about mothercraft, immunization, nutrition, rest, sleep, and exercise. So you can see the connection now that the nurse as a direct care provider. And this point leads us to the next point, which says the nurse as a teacher and educator. Your role as a teacher involves the training of other healthcare personnel and not only teaching or giving education to clients alone. You also have to mentor or teach other healthcare personnel, professional colleagues, even the auxiliary personnel. So this calls for your role as educator when you have to educate the individuals or family about healthy lifestyle, the community on the primary prevention of ill health. That is, in a community, you give health talk. Take for instance, maybe there is a pandemic or epidemic of cholera or chickenpox. It is your role as a nurse to give health education about the prevention of this particular disease. So you see, nurses are not only known to give injections. What else is our role as a nurse or the role of nurses in the primary health care? The nurse also serves as supervisor and manager. If you are engaged in providing primary health care, you have to exercise some kind of leadership. While performing this function, you are involved in the following. You assess the health needs of the community. You listen to the community's view on their needs. Very, very important. When you are working as a primary healthcare nurse in the community, you have to listen to the community's view on an issue. You don't enforce your own idea on how certain disease can be prevented or treated. After you assess, you need to listen to them. What do they believe in? How do they see this issue? And you communicate with the community. When you have assessed, when you have listened to them, then you also communicate back. Then you can advise accordingly. And lastly, the next, as a researcher and evaluator. Of course, primary healthcare system is dynamic as it deals with living human beings. Hence, a nurse has to be dynamic in our service by bringing about changes and innovations in the healthcare provided based on facts. The role involves monitoring, observing, analyzing the health conditions, health services, and the healthcare provided. With your knowledge and skills as a nurse, you are able to recommend changes or innovations in primary healthcare services. For you to play this role effectively, you need to have an updated record. And so learners, that is the end of the lesson on primary healthcare concept and principles structure. And in conclusion, we have covered this unit, the concept and definition of primary healthcare. Primary healthcare is a practical approach to make essential healthcare universally accessible to individuals, family, and community in an acceptable and affordable way and with their full participation. We've also said that the components of PHC, which are education concerning preventing health problems, promotion of good supply and proper nutrition, adequate supply of safe water and basic sanitation, maternal and child health, immunization, treatment of common diseases and injuries, and prevention of drugs and vaccine. And lastly, the principles of primary health care. That is where we'll end it today. Thank you for participating. So, may I see those of us who have questions or wants to contribute to what we have just, what I've just presented now.
Hello, ma. Good evening, ma.
Good evening.
Sorry, ma. Are we doing revision or we are going back to?
Remember, I said that in the first 2 weeks of this module, of this course,
the previous one, because we've taken this course on this course.
Yes. So none of you was in class. And because we have finished the unit for this course, instead of me just dismissing, that is why I'm bringing back the topic that students were not available during the facilitation. Remember, we only have 5 units under this course. And we did the unit 5 last week, which was evaluation that we concluded with. So for this course, we are done with all the topics. So Okay, I guess your network was poor. So as I was saying, I'm doing don't really the revision, but it's just
Okay.
like a makeup of what we were not able to discuss together. That's why I'm bringing it. So for NSC 303, we have covered all the topics. We have covered all the topics. The extra class that I'm going to have on Sunday is just to cover Unit 1. But it was actually Unit 1 and Unit 2 that when I moderated the class, the students were not around.
Yes, ma'am.
So, any other question?
No, ma.
Yeah.
It's okay. I will also try to post this, in fact, all the instructional video via our WhatsApp group, so that for those of us who have not managed to have access to the student portal, we can have access to it. Okay.
Thank you, ma.
You're welcome. On Sunday, do we agree that we have an extra class, even if it is 30 minutes for the Unit 1?
Yes, ma.
Okay. So fine, thanks. I will post the link on,
Yes, ma.
on Saturday evening. On Sunday morning, I will post it. All right. Is there any question or any clarification?
Okay.
Yes,
Ma,
ma'am.
what
The assignment.
The
We
time on
submitted
Sunday
the
is
assignment.
what
Some
time,
of us
Can we allow Seta to make a point, Thomas?
Okay, ma.
Seta, please continue.
Sorry, ma. I said the assignments. We were able to submit. Some of us were able to submit last week, but it has not been graded.
Yes, it's not been graded. I'm just awaiting other students to submit. I'm going to start grading them from next week. That's why I give deadline till 29. So after tomorrow, I'll start grading. And next week is just going to be a revision. Next week, remember, it will be our 8th week, which is the final week for this course. So it's just going to be a revision, interact together for that 1 hour. Okay, Thomas?
Yes, ma. I said the Sunday lectures is what time, ma?
It's going to be 4 to 5. Or what time do you suggest we put it?
It's okay by me, ma.
Okay, it's fine. Some of us will go to church and some of us maybe is on duty. So I assume that by that time we should have been back from church and whatever activities. So it's a deal, 4 to 5. We meet for like 30 minutes just to make up for the first class. So any other question or contribution? We have a WhatsApp group. Are you aware, Thomas?
Ma, I'm in the group chat, ma.
You said?
Yes, ma, I'm in the group chat.
Okay, yes. It's fine then. All right. If there is no question or contribution, I think we can end the class now.
Okay, thank you, ma. Bye.
All right, bye.
Thank you, ma. Bye.